I'm here today to talk with Dr. Brad Bowins, psychiatrist in Toronto, Ontario, about his new book, Activity for Mental Health. Dr. Bowins, how does activity for mental health compare to activity for physical health?
When it comes to activity for physical health, it's really all about physical activity. That's pretty much it. When it comes to activity for mental health, it's much more diverse. It's about physical activity, social activity, nature activity, cognitive or mental activity, art, hobby, and music activity. All those seem to play a powerful role.
What distinguishes your book, Activity for Mental Health?
Other books pertaining to activity for mental health focus on select aspects. Like, for example, there's books that deal with physical activity and mental health. Then there's books about art therapy or music therapy. This is the only book, at least to the best of my knowledge, that deals with all different types of activity. It brings all of those together.
Why is activity in general so important for mental health?
That's actually a very important topic because there's at least a couple of reasons why. The first being our evolution. We evolved in hunting and gathering groups, and we had to be active. We had to move about in search of food. We had to seek out safe resting places. We did this in hunting and gathering groups. Meanwhile, our tree-dwelling higher primate relatives basically didn't have to be that active. So they're not as bothered by inactivity physically and mentally. We, on the other hand, have to move about. And this gets into the profiles on a couple of ancient motivational systems, behavioral activation and behavioral inhibition. Behavioral activation is very approach, reward oriented. Behavioral inhibition is very punishment, withdrawal oriented. Now, the ideal situation for us is to be high on the behavioral activation system and low on the behavioral inhibition system. This equates with being active in various ways. So that's one key reason, active in the ways I describe, and that facilitates good mental health because of our evolution. The second is absorption in positivity. It's very difficult to not be bothered by things around us. There's a lot of negative input, a lot of negative noise, and absorbing yourself in a positive focus can actually help enormously because it pushes away the negativity. It allows it to recede. Absorption is a very mild and positive form of dissociation.
How strong is the evidence supporting activity for mental health?
Even though rating systems for evidence levels vary, it's typically 1 to 4 with 1 the highest. And the evidence for the different types of activity for mental health basically are no lower than 2 to 3. For physical activity and music activity, it reaches level 1. Music, 2, let's say 1 to 2. Now, this isn't to say, though, that any type is inferior to the others. It's really a statement of where the research is at the present time. The vast majority of research has been done for physical activity and mental health. And so in 10 years, maybe all of them would be up at 1 or 1 to 2. In other words, the evidence based on different types of studies like randomized controlled trials, solid longitudinal studies, cross-sectional studies, it's very good. It shows that activity benefits mental health both in terms of improving well-being in the general population and helping to remedy mental illness.
Music activity is intriguing, and you relate it to emotions. Can you explain this link?
Yeah, that's a very interesting point. When I first started to think about this book, I was considering putting music activity with art hobby, and that was suggested by one person anyways. But as I went through it, my suspicion was confirmed that it is really different. And the main way is that it really resonates with emotions. It can both express emotions and also regulate them. So express, if you're feeling sad, you can play a sad song, and that helps you get the feeling out. If you're feeling sad but you want to feel better, you can play a more upbeat type of song, and that regulates, it lifts your mood, it compensates. So it really does play strongly on our emotions, and there's some powerful aspects of that. Like, one thing that's been shown is that even music listening benefits. And for elderly people with cognitive impairment, it can be way more powerful than medications to calm them, to settle them. So emotions and music go together very well.
Getting back to nature as a hobby or activity these days seems to be quite the popular thing. But how do you distinguish a nature activity from, say, physical activity?
Yes, that's a very good point, because nature activity can often be confounded with physical activity. Go for a walk in nature. Well, it could be the physical activity, not the nature. Or social. People often go for a walk with somebody. And there's two ways to distinguish. First of all, just simply viewing scenes of nature on your own has a benefit for mental health. It does settle, it does activate the relaxation part of the nervous system. Also, studies have been done where they've compared, they've had a subject or subjects walk a set distance in a nature area and in an urban area. They're walking alone, so it can't be the social activity, and it's using the same type of activity, comparing in nature and urban. In nature, the nature benefit stands out. So in other words, there's ways of getting rid of those confounding influences.